My name is Dr. Laura Erickson-Schroth. I'm a psychiatrist and the chief medical officer at the JED Foundation. And today we're going to be talking about obsessive compulsive disorder. There are really effective treatments and there is help available. You can feel so much better than you feel now. OCD is not just about being neat or organized. It's when obsessions or compulsions get in the way of living your life. Obsessions are repetitive thoughts that are often intrusive and unwanted. Compulsions are repetitive behaviors that someone feels compelled to do even if they don't want to. For example, you might have obsessions that make you think that everything needs to be in the exact right order. And you might have a compulsion to put your clothes in your closet in the same exact way every time. Common types of obsessions often have to do with cleanliness. So you might have a really serious discomfort around dirt or germs or bodily fluids or animals. Being especially clean isn't OCD, but if you feel like you have to wash your hands multiple times a day to feel like they're clean, and it gets to the point where your hands are raw, that could be OCD. It's common to have obsessive thoughts in OCD that have to do with aggression or with sexuality. So you might have repetitive thoughts about harming someone else, for example. But that doesn't mean that's something that you actually want to do or something that you're ever going to do. One of the most common compulsions in OCD is checking behaviors. So a lot of people with OCD have to check the locks on their door multiple times before they leave. It's really normal to go back and check once or maybe even twice every once in a while. But people with OCD sometimes have 30-minute routines every morning that they have to get through, checking things multiple times just to get out the door. It's also really common for people with OCD to have counting compulsions. So they might feel they need to count the number of tiles on a floor, the number of nails in a wall, or they might feel like they need to repeat activities a set number of times. A lot of times people who are having anxious thoughts wonder if they might have OCD. But here's how to tell the difference. People with anxiety disorders tend to have worries about things that could actually happen to them, like losing a job or a breakup of a relationship. People with OCD who have intrusive thoughts have thoughts about things that are more irrational, that are unlikely to happen. If this feels familiar to you, you don't have to go through it alone. Reach out to a mental health professional who can help you figure out exactly what's going on. There are very effective treatments for OCD. The most common is CBT, or cognitive behavioral therapy, and specifically something called exposure and response prevention. Most therapists will have you make a list of your obsessions and your compulsions. And you'll start out with some that are less distressing to you and use the techniques that they give you to get through those. And that helps you to feel safe so that when you move on to more difficult things that you're dealing with, you'll feel like you have the coping skills you need. With OCD, it's important to find a therapist who treats OCD and knows how to do CBT for OCD. Your therapist may give you homework. So they might say, if you're afraid of germs, you should go out and touch a doorknob in a public place. And then you have to wait before washing your hands. And each time you do it, you wait a little bit longer until you feel less distressed about germs in public places. If you're afraid of going to treatment for OCD because you think you'll be overwhelmed or you won't be able to face your fears, a good therapist will always start small. The first time that you face something that you hadn't been wanting to face, you're gonna feel overwhelmed and you're gonna feel anxious, but your brain makes adjustments. And over time, your brain realizes the more you do these things, that nothing bad's gonna happen. Medication can also help with OCD. OCD often responds to antidepressants like the ones that are used for anxiety or for depression. And what it does is it lowers the levels of anxiety so you're better able to engage in therapy. Treatment can be really helpful. Even if your obsessions and compulsions don't go away completely, it can give you more freedom to live and enjoy your life. You're not alone. Reach out. There's a community waiting to support you.